everyone. Welcome to Parasol Alliance's second Thought Leadership webinar series of the year. We are so excited you all are joining us today. And as many of you know, Parasol Alliance is a technology company that exclusively serves senior living communities. So here at Parasol Alliance, our vision is to transform technology culture for senior living. Having the pleasure of serving senior living communities for 8 years now, we know you might be interested in implementing new technology at your community, but that you might not have the time to attend long demos. So we wanted to make the most of your time by offering 4 presentations today about innovative technology solutions that could potentially benefit your community. Before we get started, if you have any questions for our panelists today, feel free to post them in the Q&A below. Also, if you're tuning in for your chance to win the Amazon gift card, the drawing will not be held live. We will draw the winner at random after the webinar, and I will notify the winner via email. So without further ado, our first panelist today is Julie Bazzari from OnShift, and we look forward to learning more about OnShift. Julie, thank you so much.
Thank you. So I'm going to go ahead and share my screen here. And I want to get started with a little bit about who OnShift is as an organization. Presently, we have well over 7,000 different communities across the US as well as Canada, focused in the skilled nursing, assisted living, memory care, senior care market. We have a 49 promoter score, which is pretty impressive, especially in this space, with most of our clients staying with us due to our support rating. Overall, through our tool, you're able to schedule more efficiently, align to budget needs. And with that being said, it's allowed our clients to schedule well over 5 million shifts a month in total. One of the things that I think is great about our company, coming from senior living myself, is we stay connected to the space. So we are a part of multiple organizations such as Argentum, really focusing on, of course, the senior living space. When it comes to looking at new technology, it's always important to be mindful of your security. Integrity and ethics are building blocks for us here at OnShift. So we're certainly committed to the information, the different security requirements that your IT team may need to have in place, getting ahead of any cybersecurity threats, so on and so forth. So what does OnShift have to offer? We are a scheduling and labor management tool, also helping with retention within communities. So we offer a full tool to help hire candidates, keep your candidates, help with retention, and then, of course, scheduling. So a talent acquisition or ATS, scheduling and labor management, plus payroll-based journal tools, different surveys and reward systems, including an automated rewards tool that you can use to reward staff within your buildings. A lot of different reports and an entire customer success team that can actually customize those reports. And that would include quarterly and executive business reviews, the ability to set up automated reports, and so on. So if we get into next, what are the different solutions that we offer? I always like to say this is the candidate to employee life cycle. So this is our applicant tracking solution. It allows candidates to apply on any device connected to the internet. We integrate with all big, online job boards. The biggest one, of course, is Indeed. And we have the ability to auto refresh those openings on Indeed. So that can save a ton of time if you have folks doing that manually. It can also ensure that your jobs are kept closer to the top to ensure more traffic. The other nice thing is you can totally, change out how you do your different processes. And what I mean by that is you can customize the workflow for care staff versus maybe a manager. We don't want to have the same workflow, as we want to be sure that we're not losing candidates. We can also then embed different, documents or such that folks need to sign off on. And then once hired, we can integrate with your HRIS system and push that new hire over. Once the candidate is hired, we want to schedule them. So our scheduling and labor management tool allows, if I'm a building leader, I'm going to have dashboards to see what my overtime is, what my PPD is, or depending on how I budget per acuity. The other thing is we integrate with time and attendance systems, EMR systems, so we can pull in your census, pull in an employee feed daily, and then most importantly, pull in the punch information. So this allows me to actually see what I'm scheduling, what I have planned, and what actually does occur. Employees have the ability to see their schedule on any device connected to the internet. So I can log in on a phone, computer, see my schedule, pick up open shifts. And what's cool is if I pick up an open shift that won't cause overtime, it can automatically be approved. So that can certainly be a time saver. It can also give the perception that folks are creating their own schedule, where really you control, right, what folks can see. The ability to communicate, the ability to insert state minimums, hopefully no federal minimums, but I know those are on the table, and allowing, regional director of operations, other folks to get a clear visual of where their labor's at. The other thing that we can do is if you have folks that work at sister buildings, that's a great way to utilize staff. We can set them up to be able to see open shifts at different buildings across the organization. One of the most positive outcomes with our tool is it does encourage open communication. So staff are able to receive messages via text, phone call, email, push notification, and it can be about so many things. It can, of course, be about an open shift that you have. Maybe it's due to a call off, or we're just sending out a message reminding the team that we have open shifts and to log on and review. But I can use it for more than that. I have DONs that use it to wish their staff happy birthday. I have folks that just remind the team about missing punch forms or those sorts of things. And what's nice is staff can view those messages right in their login. So that's helpful if people get new, phone numbers often. I know I experienced that when I was in this space. They're going to have one place where they can go and they can see, certainly all of that information. The other thing too is we can embed communication pop-ups. So what I mean by that is I have, an organization, maybe they're utilizing the scheduling tool. I can have different tool tips pop up to encourage your, best practices regarding staffing and of course, staffing to budget. It's more than just tool tips, reminding the team of who they can reach out to at OnShift for any support. But it doesn't even have to do anything with OnShift as well. You can put videos in there, appreciating your staff, being thankful, and even different polls and those sorts of things. So that really leads me to our next tool. When I hire somebody, I want to be able to schedule them, as I mentioned. I'm going to be able to build out their different staffing patterns, create all of that, and it's going to allow me to create my schedules more efficiently. We work to build in your shift times, we work to build in those patterns, and once that's copied out and we are integrating with your time and attendance tool, we offer an engagement solution. So I always say this shows building leaders all of the stuff that they wish they could see, but they don't have time to see or they don't have the tools, because it's really how staff feel. So it's going to show folks who are coming to work on time, calling off, and they're going to be able to see that on their application as well, which is nice from an accountability perspective. I can see how well I'm doing in that regard. It's also going to allow me, if I'm an administrator, I'll have a dashboard and I'm going to be able to see a summary of how, my folks are doing, ones that are doing well, ones that maybe need a little bit of coaching, and I can message them directly through the tool. The whole point of this is we want to get ahead of the game when it comes to, folks turning over. One story I always like to share is I had a caregiver once who started to be late to work, calling off, and she lost her vehicle and didn't want to share that with us, which is understandable. So things like this allow us to track trends. And if I would have had this in my building, I may have been able to have a proactive conversation with her about that. The other big thing is we want to ensure that staff have a voice. That is important now more than ever. There's 5 different generations in the workspace. So we can send out surveys either weekly or bi-weekly. How's it going is all it says. We also have some new hire surveys and the ability to create your own. For me, this really does allow, leaders to create connections. When staff earn a number of points, because as they're punching in and out on time and not calling off, we do automatically give them points in the tool. And they can turn those points in for a reward. We offer an automated rewards tool specific with gift cards. But these are just some other neat things that we have had clients do in conjunction with our engagement team or solution, is it's helped to really enhance how they onboard folks, and then of course, ongoing to stay and grow with the organization. We also, of course, always want to be mindful of, the economy, giving staff resources, especially regarding funds. So we do partner with PayActive to allow staff to access earned but unpaid income. They can access 50% of their earned income, capped at $500, and they can push that over to their bank account, a prepaid card, they can pay a bill. And this is all based on the hours they work from your time and attendance. So what's unique about this, some things that we have seen, and this is our mobile app for staff, where they can see all of these different components. Staff have to punch in and out to see that dollar figure grow. You'll see that $120 on my screen. And if they don't, it won't grow. So it can encourage folks to be more mindful of punching in and out. And then the other thing is they're more likely to pick up an extra shift, because just because they took out those funds now, right, does not mean that they don't need those later. I think the biggest thing that we really want to encourage here, and one thing I want to say before I move into my final piece of the presentation, is we want to ensure that you're utilizing your staff. That is most important for retention, positive resident care outcomes, and so on. So being able to proactively make a schedule that you can post online where folks can see openings and get those filled. You can even share staff, as I mentioned, with sister communities, if that's something you have today. And then if you do need to use outside agency or independent contractors, the ability to put that information in here. So with that being said, we actually are a part of the ShiftKey platform. We are the OnShift division, and we have the ability to push openings over to the ShiftKey marketplace if I am an organization that sometimes needs some help regarding filling open shifts and that sort of thing. Why would we want to have that? And the answer is total workforce visibility. This allows me to be just in one system, OnShift. I can see my staff, and if I am utilizing an independent contractor, they will be color coded. As an administrator, I love this because I'll have alerts on my dashboard knowing the number of independent contractors who have picked up. I can be proactive with this. Is the goal of, we want to use our people. Let's say that I don't need that independent contractor anymore. I can cancel them with no fee up to 2 hours in advance. And of course, use, my team. We have really seen this be successful when it comes to being more mindful of spend. Again, utilizing staff is, of course, the whole goal is to only use your people and have them grow within the organization. So with that being said, the last thing that I did want to show was specific to the retention side of things. This is actually some example data from some of our customers. We know that staffing can support care, and we know that it can support retention. And with, how things have settled with COVID, we're kind of in a cleanup year. So being able to reinvigorate your scheduling and labor management process, looking at your PBJ tools, we can, send that data over if you're utilizing independent contractors, and it can be uploaded in our PBJ system. Finally, any of our clients are going to get a customer success manager, an implementation team member, as well as a project manager. My final thing that I would say in regards to rolling something like this out or support, you're always going to have access to OnShift's 24/7 support. And we also do have the ability to do ongoing training at no additional charge. So I appreciate everyone taking the time to learn about OnShift, and I look forward to any questions.
So if you have any questions for Julie, please feel free to post them in the Q&A. And if you ask your question and we've moved on to the next presentation, I will make sure that Julie emails you a response to your question. Looks like we do have a question here. Oh, okay. Ashley said she's very thankful for your presentation. It was very informative.
Oh,
I have
great.
to agree.
Great.
Well, if there are not any other questions, oh, I see another one might have popped up. Oh, no. So if you have any other questions, please feel free to write them in the Q&A and we will go on to the next presentation. Thank you so much, Julie. I really enjoyed you sharing more about OnShift.
Of course. If anyone has any other questions, let me know.
Thank you so much. Our next panelist is Jeff McSpaden, and he is with Composure. And I can't wait to learn more about your soundscapes, Jeff. So whenever you're ready, we're ready to hear more. Thank you.
Thank you, Katie. Hi, everybody. My name is Jeff McSpaden. I'm the co-founder and CEO at Composure. I will quickly share my screen and we can get going. Might be helpful with a little context on my background. Before I started this company, I had a long career as a film composer. I worked in the film, TV, and advertising industry, writing original music and producing sound for these media experiences. And, you know, the work in that field and sort of my live musician days prior to that really gave me a firm understanding of, you know, how crafting sound to influence a human experience is done and how vital that is, and really felt strongly it was time to move sound out of the realm of entertainment and into the realm of functional life and healthcare specifically. So what we're doing at Composure is we're initially looking at tackling one pervasive issue, and it's around the topic of sleep. If you consider that sleep is one of these things that we all spend about a third of our lives doing, it's a pillar of our good health. As a matter of fact, it's the quality of our sleep that helps dictate the quality of our ongoing health in various ways, as you can see here as a partial list. But unfortunately, for a vast majority of older adults, especially those living in congregate living settings, they're experiencing chronic sleep issues. And, you know, why does this matter? I mean, you know, as I was saying before, quality of sleep dictates quality of health. So what usually happens with these chronic sleep issues is that we see declines in physical and mental health. We see that they are at a higher risk for falls. There's numerous published studies that actually correlates poor sleep to a higher incident count of falls. And then ultimately, this leads to a lot more burden for staff, which obviously then translates into higher cost of care and higher cost of operations for the communities at large. And what we've discovered is that usually, you know, operators and care leadership, clinical leadership in these organizations they readily recognize that sleep is a huge issue, but the ways in which they're approaching solving those issues is really not doing the job. I mean, first and foremost, we all know that medications are being used, which come with harmful side effects. There are patient monitoring systems, whether they be passive sensors in the room or wearables, alert systems, that kind of thing, which are fantastic for detecting events and alerting staff, but they actually do nothing to improve sleep. And then you have finally this DIY solution category, which is kind of our naming for all the wonderful, compassionate, loving things that staff do for their residents each night because they know them so well in their preferences. But these approaches are very unscalable, and they're kind of hit or miss. What might work for Miss Johnson one night may not work for her the next night. Or what works for her on a consistent basis just isn't appropriate for the next person down the hall. So it's, you know, ultimately leading to needing a lot of staff time and attention in order to implement these types of approaches. And actually, all of them ignore a very basic but important fact. And that's that care environments are notoriously terrible places to sleep. And this isn't by fault of staff activity. It's not by fault of the residents. It's really a culmination of things and just the basic nature of congregate living settings. And actually, there is sort of a key component to this. The reason, the number one root cause and reason for these environments being terrible places to sleep is actually noise. And what I'm going to do very quickly is just share with you a little bit of what I mean by noise. That's obviously a very short and condensed version of what's typical, but essentially, you imagine if you've ever stayed overnight in a hospital or perhaps even overnight in one of your own care environments, you might recognize what the issue here is. There's staff doing their job, there's monitors and machines making their sounds, there's carts going down the hall, there's conversation, there's doors opening and closing and so forth. So there's a lot of just natural unintended noise that gets produced in these environments. And the reason this has an impact on sleep is because humans are essentially wired for sound. We have evolved as a species over millions of years to respond to sound for our own survival. That's how our system is built. So, and as a matter of fact, the regions of the brain that process what we hear are some of the oldest structures of the brain. So this makes our responses and our reactions instinctual and automatic. We don't have to think about it. And as a matter of fact, this is true when we're awake and when we're asleep. So we got to asking ourselves, what if you could harness that sort of essential power of sound and administer it to drive better sleep and better health outcomes? And if we were successful in that, could it be an effective non-pharmacological intervention that is a key component of a prevention care strategy? And can we do it in a way that involves very little effort by staff for it to be successful? So with those questions in mind, we've developed Sound Blanket. This is our it's actually currently the only sound-based sleep solution built from the ground up for long-term care. And before I go any further, I just want to explain that blanket is used in a sort of poetic sense. It's not a physical blanket. This is the use of sound to blanket the environment, quote unquote, to create more comfort, care, and better sleep. And how we're doing this is it starts at our core, which is our audio content. We've developed sound sequences that are designed to support the entire sleep cycle. So using sound to help cue when it's bedtime and create a more calm environment to fall asleep in, and then continuing to use a frequency-based sound approach that covers all those distracting noises in the environment all night. And we do this on a time trigger, so we're able to deliver the right sounds at the right time and at the right volume to meet individual resident needs. And this is all made possible through our remotely managed audio system that requires, again, zero effort from staff in order to operate. Because we think that, and firmly believe that staff should be focusing on caring for residents, not managing the technology. And so it all starts with the Sound Blanket Cloud, which is where our remotely based audio content and software is housed. And then that communicates with a local server device that we provide for each community so that we can monitor and manage communications with a networked speaker system. So that networked speaker system essentially is one unit per bed, and they're independently addressed and controlled, fully remote from our system. So that means, room one can get the one sound selection at the timing that's most appropriate for their sleep cycle and at the volume level that is most appropriate for their hearing ability. And then the room two is a different set of settings, and so on and so on. And what we do there is make a very easy to read dashboard listing all the residents and their current settings and so forth. So should staff ever need to make adjustments or reference that schedule, they can do so just through their own web browser. How do we know this works? A lot of people have tried different approaches using sound in this way. We've actually conducted collaborative research in a memory care setting through partnership with the Center for Health Design, which is a translational research organization, and our friends Garden Spot Communities in New Holland, Pennsylvania, where we conducted research in this memory care setting, like I said, and we were all fairly pleasantly surprised at the amazing outcomes that we saw from this study. We reached 2 outcomes that will reach the level of statistically significant. And those specifically were a reduction in daytime drowsiness, which our approach to sound for better sleep was 99% attributable to that outcome. There was virtually nothing else that in the study period that would have produced that outcome. And similarly was cooperation with care, which was really sort of a misnomer. So we added independence as the qualifier there, because what we found very interestingly was the participants in our study that slept the best were far more independent and needed less points of care, needed less instruction, needed less having things provided and done for them than they did previously. So it actually sort of meant a bit of change in the caregiving culture as a result of better sleep. Other things that improved, just to give you a quick idea here, we were measuring behavioral outcomes in this study, and so we saw most of the ADLs improve, so bathing, dining, rising and retiring, dressing, all those things showed marked improvement, as well as a reduction in falls. So this particular setting where we did the research was a pretty high performing population with very low incident count of falls to begin with. But even within that low incident count, we saw an improvement and a reduction in number of falls. We're really proud that this study has been very thoroughly reviewed, peer-reviewed, and now published in leading scientific journals, and recently highlighted in McKnight's and Senior Housing News. So we launched just last year, at the late part of last year, as a matter of fact, and we've already supported over 200,000 hours of sleep at this point. And we're getting amazing feedback from the communities that we're working with. We're seeing tremendous amounts of growth this year in terms of interest in new opportunities to provide this for furthering additional communities. And really, the mission here for us is to turn sound into medicine. And our approach to that is actually creating great benefits community-wide. So for the residents, it's about reducing falls. It's about reducing reliance on certain medications, really improving quality of life overall for those residents. And then for staff, it's creating a much more calm and happier work environment for them. And furthermore, for operators, this really means helping them bring more innovation into the community and also differentiating themselves from the folks down the street. So that's a quick look at Composure and our solution, Sound Blanket. Really appreciate the opportunity to share this with everybody, and love to answer any questions anyone might have.
Thank you so much, Jeff. If anybody has any questions, please feel free to post them in the Q&A, and Jeff will answer those for you live.
Oh, okay.
We do have a question.
Mm-hmm.
So what's the difference between pink and white noise, was asked by Marlene.
So I'll try not to geek out too much on this answer, because in the realm of sound, I could go on forever. But essentially, white noise, which is kind of the more common type of frequency approach, that white noise represents all frequencies from very low to very high at the same energy level, so the same volume level. It's kind of like a wall of sound that comes at you. And that might be appropriate for certain settings, like busy office environments where you were trying to cover conversation, but it's not super effective at helping people sleep better. As a matter of fact, white noise can generally be sort of fatiguing to the ear over long periods of time. Pink noise, however, takes it starts with white noise and then slowly de-emphasizes the sort of high frequency stuff. So all the hissy qualities of white noise are kind of rolled off, if you will, and it creates a warmer, better sort of sonic profile, one, to promote deeper rest. So not only did our study produce that outcome, but there are other published studies that links pink noise to eliciting deep wave sleep, which is sort of the more restorative stage of sleep in the folks that they were studying with. Not only that, but we also found that it generally fit, just from a frequency spectrum standpoint, it fit older adults' hearing profile a lot better, so it's more appropriate for their ears and more easily heard by older adults.
Thank you so much for that. We also had a comment. Marlene just wanted to say she found your concept very innovative and she loves it. So thank you so much. I appreciate your presentation, Jeff.
Thank you.
And our next presenter will be Greg Petrosian from Skypoint. So Greg, we look forward to learning more about everything you're willing to share with us.
Hello, thank you for having me, Katie. Let's get my screen sharing. Let me know if you can see it.
Yes, we certainly can. Thank you.
Awesome. Welcome, everybody. I'm Greg Petrosian, Director of Sales at Skypoint. We are an industry AI platform that's focused on regulated industries. My background is in healthcare and healthcare consulting, and we have deep roots in healthcare and specifically senior living. Now, I know AI is all the rage right now, and I'm sure everybody has directives of learning more about AI and more specifically generative AI. So hopefully through this next 15 minutes, you have something you can take back and tell your boss that you learned something about AI today. I will be watching the Q&A and happy to make this more of an organic conversation if people have questions as I go. I know I may get technical, so happy to keep this open-ended versus just saving the Q&A till the end. A little bit more about us at Skypoint. We are here to help bring a Copilot experience to chatting with your data, whether that data lives in systems, whether that data lives in documents, audio files, video files, anything you can think of, or even if that data lives out publicly. We want to help bring, unify, and create a chat experience, as well as provide robust analytics to senior living operators and REITs and pretty much any type of organization in the senior living world. Our headquarters and where I'm calling in from is right here in Portland, Oregon. And given our roots with and our partnership with Microsoft, you can also purchase our platform, whether it's through the Microsoft Azure Marketplace or directly through us. So what type of customers do we work with? And when I'm talking to customers, what is the current state that I typically see? So usually when I'm working with a customer, they have operational systems, maybe some of the systems you've heard today, that are point solutions or siloed solutions, such as, you have your financial system, your CRM, labor time clock, and I'm sure a host of many other systems. And they haven't really got to the point of having unification across those systems, and which is what is typically called a data warehouse. Now, to really leverage an AI copilot, you not only have to bring and unify that data together, you have to make that data AI enabled, where you've provided the right metadata, the tagging, and the context, where a large language model can look at your data and across your systems and really understand what is going on. Now, also in the senior living world, I know you're also working with EHRs, or electronic health records. Now, electronic health records pose a very complex issue where you have both structured data and unstructured data that you can get insights from. Now, what do I mean by that? Think of the fact that you have your electronic health record system that has Things like, hey, I've got my patient name, their demographics, typically an MRN number. We have, what comorbidities and different health issues, and those are all contextualized in tables and typically rows and columns. And then you also have things like notes, chart notes. You have notes all over the place. And those notes, you can't really glean a lot of insight from. And so think of this system as having both structured data and unstructured data all together. And typically what I hear are these systems are archaic or clunky or cumbersome. And when something is happening and your care staff need to get information very quickly, it does take time, and that's difficult for them. Now, there's also this concept of unstructured data, and I'll dive into this a little bit more in my next slide. But think of your unstructured data like the documents, files, images, PDFs that you have strewn about your organization, either in SharePoint or network drives, and it's really hard to find exactly what you're looking for. Typically, you have people scheduling meetings or asking each other questions and then having to dig through your morass of your digital footprint to find things like your policies, procedures, or sensitive information. So I would love a show of hands of those that maybe this resonates. I know we can't show hands here, but I will just figuratively think of it and seeing the audience. So how do we go about bringing all this together and creating the experience? So on the left, you'll see the unification aspect of bringing this all together in a warehouse, or what is now more modernly called a lakehouse. Then in the middle is that actual experience where you can chat with the data. And what we provide is not only a large language model and the foundational models that you've possibly heard out in the wild, but we provide industry context to that large language model specific to senior living. And providing that specificity, we are able to provide more reliable and more accurate answers across your systems, whether it's a caretaker, administrator, or C-suite or leadership that's asking questions, they can get those answers and can trust them. Now, you can use generative AI for many different use cases in many different departments. We see the use of analytics, being able to get more timely time to insight, such as, hey, can you provide me the overtime hours across all my facilities? Can you do benchmarking? Can you provide me year-over-year trends? Also, we think of workforce automation. Hey, can you write this email to this resident's family about a policy or procedure? We think about knowledge management, being able to ask a question around policies and procedures. We think of sales and marketing. Hey, help me write this social media post about this new facility that we have that's being opened. So I'm sure everybody's creativity can run wild as we've seen people take more and more advantage of tools like ChatGPT. Now think if you have that specific ChatGPT-like experience at your communities. So I promised that I would teach you something about AI today, and I think there's one thing you can take away is this understanding of at your communities and the systems that you're leveraging, there's a difference between structured data and unstructured data. And what large language models have really helped us to do is accelerate the ability to take advantage of all that unstructured data that you have in those chart notes, in those documents, in those PDFs, and really help empower both the caretaker or the administrator to be more effective in their day-to-day work. And then also on the structured side of it, I'm sure organizations and operators that have a data team are just inundated with their responsibilities to keep the lights on with reporting. Every day there's a new business question or ask that they may not be prepared for, that's already built in reports or the reporting in your systems. Think of having a data analyst in your pocket that can answer quick questions, and you don't have to bug your data team if you have a data team. And if you don't, the Copilot can really help fill that gap. And whether it's us or your team is standing up reporting capabilities alongside the Copilot, the business can get answers to their questions in a matter of seconds. So this is a quick bird's eye view, and I'm not going to stick to too many technical concepts in our short time together. But this idea that organizations that are leveraging Microsoft technologies and tool sets, such as Microsoft Fabric or Power BI, we are directly interoperable across your Microsoft stack, where we can have your team working with us in tandem and in collaboration, and one day handing over a lot of the solutions to your team, while also providing you that experience with a Copilot. Think of the ability to build that data infrastructure that we are going to use for your private Copilot, in addition to being able to deliver more robust analytics and reporting on that same copy of data and on that same architecture we build out. So build it once and use it for multiple modalities. Do also want to mention, we're a better together story. I'm sure everybody's hearing about ChatGPT and M365 Copilot. We're not directly competing with those Copilots. We're here to really fill that gap between your organizational systems, anything outside of M365, anything outside of the corpus of the internet, and really bringing that context, providing that feedback about your organization, making your data AI ready. So you have a Copilot specific to how you run your business, your operations, and how you provide care. This is a quick view at our private AI Copilot that we can white label for operators. And so you have your, whether it's care staff or administration, when they're working with the Copilot, they feel like it's an internal tool of theirs. We can white label our logo that you're seeing in the top left. We can do a lot more on the UX, the user experience. So when they're chatting with the Copilot, it feels like home to them. But I have in all these different boxes are all the different types of use cases and business units that we work with. Typically, if you're wanting to work with us at Skypoint, we will go through a workshop to understanding all the use cases that could drive business value, and then prioritizing those use cases and how we can deliver those use cases through this chat experience. So from knowledge management, pop health, your operational or financial data, sales marketing, clinical data, quality, and then also knowledge management. So I am pretty near time there. I do want to leave enough time for questions. And I see Casey is asking, can I ask the Copilot an example, like give me the recent medical history of Beth Smith and come up with a care plan? Yes. So in our personal demos, which if you'd like to reach out and get a one-on-one demo with me, those are prompts and questions that I have in my demo. Hey, can you pull up the recent history? Or hey, can you pull up the vitals for Joe Smith? And can you help me based on the data you have in our EHR and the preferences we know from your resident engagement software? Can you help me write up a care plan? And I will do that. John, do you see AI taking away from the personal touch? I do not. And I think that's why it's named a Copilot. It's not named a pilot. What have we been talking about for the past 10 to 15 years in healthcare is how do we bring caretakers closer to the patients? Now, for a long time, you've seen doctors, caretakers, and nurses sitting on their systems like this versus actually engaging the patient. And what I believe a Copilot is going to do is start removing more and more of those technical barriers for the individual to giving the care. And I think it's able to also provide more personalization for the caretaker. So rather than walking into the room, having to stare at a screen or ask questions that have probably been asked tens or hundreds of times to that individual, you can very quickly just get the history and get the information at your fingertips, get caught up, and then walk into the room with that resident. Any other questions?
if there are not any other questions for Greg, I want to thank you so much for taking us through that AI journey with the lake houses and the Copilot. Thank you so much. I learned a lot. And if we have any other questions, I will make sure Greg reaches out to you through email. Thank you, Greg. So
Thanks,
our
everybody.
final panelist is Rose Scott Powell from PointClickCare. And we are super excited to learn more about PCC. So Rose, take it away for us.
Wonderful. Glad to be here this afternoon, so thank you. Let me share my screen. All right. Well, hopefully you all are familiar with PointClickCare, but if not, we are an electronic health record supporting senior care. So we are exclusive to supporting the clinical and financial needs of customers from skilled long-term care, AL memory care through independent living, as well as, models of aging in place. At PointClickCare, we really do focus on some key aspects. Our industry has been changing, and we're starting our journey with value-based care. And there's some key things that come to mind. So at PointClickCare, when we look at how we're developing our system, we focus on three key things right now. We're looking at those care transitions. How do we help make sure that we have the right information when we're admitting or moving in a new resident, as well as how do we make sure we're sharing the right information when you do have to transfer a resident back to the hospital or you're discharging them to the community. Clinical outcomes. So clinical has always been a focus for everything we do. We want to drive the best outcomes, and we want our seniors, our residents, to live their best optimal life. So that has always been a focus of what we do day in and day out. But how can we look at some tools that can really make that better? And as we've said all day, it's, get us back to the bedside. I'll just let you know, I am a registered nurse, so I have been on that side. And clinical is really key for me when I talk with our customers. And then financial. We definitely should be getting paid for the care that we deliver. So today, I really want to look at three solutions, tools that we have in place that really do support those better outcomes, but also making sure that the resident is the center of that workflow. So I'm going to start with Nursing Advantage, which was designed for our skilled and long-term care communities. Nursing Advantage is a best practice standardized assessment tool that really focuses on having that comprehensive assessment, providing some clinical guidance proactively as we are doing that assessment on our resident, and then most importantly, how do we get quality data outcomes out of our documentation? We can do the best documentation, but if we don't get data out that helps us really understand our resident and make the changes needed, it really just becomes the documentation we've typically done on paper. So with Nursing Advantage, and I'm not going to go through an assessment, but I want to show you the end result of using Nursing Advantage. So by doing those standardized daily assessments, whether it's skilled or long-term care, we can actually look at the answers to those assessments, the data that's been put in, and we can generate a total score for our residents. So the acuity screen within our clinical actually helps you understand morning stand-up, what are the residents that are showing changes and that we should really focus on as we begin our day. So you can see here, I have the list of acuities. Most of my residents are doing well, but you can see we have a total of 9 on one of our residents. So let's drill further down in that. So I'm going to use Barbara as an example. So when Barbara had a total score of 15, when I open up that, I see 2 different metrics that got me to that 15. One with the green dot are my abnormalities. Those are abnormalities I was expecting with Barbara because of the diagnoses, why she's at our community, and we already have all of that built into our care plan. So we know these are things we're helping her with, her high blood pressure, issues with falling, things like that. Where it is alerting us is the triangle in yellow with 7 condition alerts. Those are things I am not expecting to see with Barbara. So there's a skin issue, or there's a temperature or possible change in condition there. So this really helps me to look at Barbara and say, okay, we need to figure out what's going on. Now, the next thing it does for us is it says, okay, this is the assessment we did in the last 24 hours. Let's look and compare those results to the two previous assessments. So it quickly, right from the same screen, gives me more information so I can see how something is trending. And I think that's really important as we learn to what we want to do to change her care services, when we need to reach out to a physician. So it's really giving us those insights. So let's move on to senior living, assisted living, and memory care. One of the tools we put in place for senior living specifically is a tool we call Companion. And as you can see, it is a tool for the tasks and medications required for the residents that have made our community their home. And it's putting that tool right in the hand of our caregivers. What I love about this tool are two things. Number one, if I have been on vacation for a week and I come back in, and Peter here moved in 3 days ago, before I go into Peter's home, I can actually learn things about Peter. What are the tasks and care services I'm providing? What are some personalized things I should know about him? I have ability to take that quick look and be more confident that when I go into Peter's home, I know exactly what service and care he needs. The second thing I like about this is there are times as our residents move in and make our communities their home, they're aging in place. And what was true 3 months ago when we moved in may be different today. So this companion also gives me ability when I finish with Peter to say, okay, I provided 2 additional tasks today that were not scheduled. So unscheduled tasks that push back into the core EHR to let our wellness team know we've had some changes that we might want to keep an eye on. When we look at senior living, we kind of bring this all together on what we call service package management because they all do support each other. If you're doing levels of care in assisted living, that level of care form evaluation that you do at the beginning supports that service plan that you put together, that personalized care for your resident, as well as pushes that information out to your point of care for those tasks that your caregivers are providing. And then the unscheduled services trigger back up saying, okay, we've noticed in the last week numerous unscheduled tasks required by Peter. Maybe we need to go ahead and do another level of care evaluation. But the best thing is, if we do need to move Peter from a level 2 to a level 4, we have that unscheduled task documentation to have that conversation with Peter and his family about why we're looking to make these changes. Everything, even as we move into value-based care, it is all about the resident. They are the center of what we do every single day. But we also have to learn and work with our hospital systems, home health, physician practices to make sure that we really are providing the best care to our residents. So one of the other and final tool I want to talk about is PointClickCare Connect. And this is an integration for both our skilled and assisted living that connects you to the Care Equality Network. The Care Equality Network is a national network, and it is joined by hospital system practitioners and communities like yourself to share information, that continuity of care documentation, so that we all have better awareness and can provide that visibility into the different episodes of care that our residents have. So in PointClickCare, when we're in that clinical chart, that PointClickCare Connect button is right up there at the resident. So if Abby just moved in this morning and I'm going to go ahead and hit PointClickCare Connect because I want to see what that CCD discharge information from the hospital information and how that could help us. So as I click on there, it uses our ADT information, pushes it out to the network and does a query. And I can see here, I'm looking for that continuity of care document. There it is from the hospital system she was at. I'm going to click on it. I'm going to download it and bring it into PointClickCare. So there's 2 components here. I'm bringing that CCD in. I can see information right here. I'm showing these are the problems that the hospital documented on discharge. But you can see the select button as well. I can look at and review these and bring some of these problems over into the active chart of PointClickCare. So when we bring over that CCD, besides the problem list, we can download and bring into the system medication, allergies, and immunizations. But all of those will be decided between your wellness team of what is going to be brought into PointClickCare based on the care that you're providing in this as they move into your home. But then you also have the ability to look at procedures, results, vital signs, social history. So right off, you're having a lot more information about a new resident that we didn't have before, or that we got in a lot of paper formats that we had to go through. So really, I just wanted to share those 3 solutions and how they really are directed to make sure we use data to support those better outcomes and to really provide personalized care as we all look at advancing care together. So thank you.
Thank you so much, Rose. And we do have a question from Lynn, which is, how often should PCC be optimized? Great question.
Oh, as far as working with us to review what you're using, and I guess.
Yes. Yeah, she's wondering how often it should be optimized.
So I think you should, if you're utilizing PointClickCare, you should have at least twice a year, I would say, you should have a review with your team, your customer success team, to really look at the tools you have to make sure you're utilizing them. We have lots of resources that we can help with to make sure that you really are getting the benefit of the solutions you have in place.
Wonderful. Thank you so much. Does anybody else have any questions for Rose? Well, thank you so much for that presentation, Rose. And if we have anybody else submit questions, I will certainly have you reach out to them via email. Thank you for your presentation.
Thank you.
And thank you to everyone for tuning in for our second Thought Leadership series of the year. As I mentioned earlier on the series, if you won the Amazon gift card giveaway, I will email the winner only and notify them that I'll be sending their prize over. So when the series is over and the window closes, you will see a second window pop up, which is a short survey about today's series. And we'd love you all's feedback. And we hope you all would consider sharing that with us so we can develop a better series, more tailored to your community's needs in the future. And speaking of the future, our next Thought Leadership webinar series will be held on Friday, August 23rd from 12 to 1 Central. And later this afternoon, not only will you receive a recording of today's series, but you'll also have the invitation for the August series included in that same email. So we appreciate your time and you all joining us. We hope to see you in August. Thanks so much. Have a good weekend. Goodbye, everybody.